Welcome back, everyone. Betska, the Guru Coach, together with Raj Vashisht, Mindful Leadership Beyond Borders podcast. And our esteemed guest is Dr. Misty Wilkie. And in part one, we had a very robust discussion about her earlier years and her son ending up in a hospital with a stroke at the tender age of 5 months, which is still unbelievable to me as a mother, and her story and how it kind of shaped her life to be in a nursing leadership position today. So, Misty, let's continue your story about moving into higher education and leadership positions, and what inspired you, and what your dream is today.
Okay. Yes. So I think I left off that I was at Bemidji State. I then went on to earn my master's degree at the University of North Dakota, and was part of a bridge program that was a federally funded grant program to double the number of American Indians with a PhD in nursing. So it was a perfect fit for me. So
Yeah.
I graduated from UND and then immediately started the PhD program at the University of Minnesota School of Nursing. And when I finished my coursework there, I didn't have a job. So I was, figuring out what I was going to do with my life. And, I'd been going to school for many years, so earlier I said I didn't know what I was getting myself into when I set this goal to earn my PhD. Had I started out my college career thinking, I'm going to go to school for the next 13 years of my life, I probably would not have done that.
No.
Um, it's very overwhelming to think about. Um, so I found a job advertisement for our local community college where I was living at the time. They were looking for faculty to teach nursing, and this was in April, probably. And it was for a summer term. So I applied for the position. I got it. Um, I received, textbooks and all of the things that I needed a couple weeks before the summer term started. Uh, I had never taught before. I had taken a class on, teaching and learning, but um, I had never taught a course. And suddenly I find myself in this position where I'm creating exams, I'm creating PowerPoints, and I'm struggling to keep up. I am drowning. And the worst part of this is that these are LPN students. This is their last semester before they graduate, and of all times, it's the summer. So I had these students from 8 to 4:30 every day for 6 weeks, and I was their only faculty, and they knew I was new. So it was certainly not the ideal situation to be put in for a first time teacher. And I just feel so bad for these students. Um, and if I was a quitter and I had not inherited my dad's trait of being so stubborn, I probably would have quit. Um, but I'm not a quitter and I am very stubborn. Um, so I applied, to teach again in the fall semester. And then after having, support and help, I fell in love with it. And I really fell in love
Ah,
with helping underrepresented students achieve their goals. So that was in 2005, and I haven't left higher ed.
hmm.
I, often think about the reason I became a nurse. I wanted to help families and be an advocate for them. But I shift my thinking and, that I can have a much greater reach by teaching nursing students how to be a nurse like Ronnie. And that's where my
Yeah.
shift came.
Well, that's what I was going to ask you next was, there's the usual stuff, the technical aspect of being a nurse. Yeah. The technical
Yeah.
stuff, right? But how about the heart stuff? What are the top three things that you have been teaching these students so that they could be like a Ronnie? What what have you been teaching them? Because I'm sure it
Um,
would be different from, yeah. Go ahead.
yes. So it's always, teaching or treating patients as individuals. That's always number one. You can have an American Indian patient, but there are 575 tribes in the United States. Every one of them
Wow.
is different. So
Mm,
there isn't a standard of care for treating an American Indian because they are all so unique. But that goes
mm,
for any patient that you have. They're unique. You ask, what do they need in their healing process, and how can you help provide that? No
mm,
matter what it might be. Respecting everybody's individual beliefs is something else. We don't have to agree with everything patients choose to do, but we have to respect their decisions and them as individuals. Um, and communication is another big one. I don't think it's
mm,
possible to over communicate. You want to make sure that patients and families have all of the information they need to make informed decisions.
mm. I have a thought. I have a question. I'm very interested in this answer, and that is, I'm a big believer in healing herbs. Herbs to heal the body, and
Mhm.
of course, you're. Have you been able to merge, the amazing American Indian medicine of herbs and roots from the forest and with the with the pharmaceutical aspect? Have you been able to do that at all? I'm curious.
Um, not as an individual and not as an institution.
Okay.
Depending on where folks live, there are things that are incorporated. Some of our facilities do have medicine men or spiritual healers
Okay.
that
All right.
are heavily involved in
Mm,
uh, their healthcare institutions. We do have a lot of hospitals that allow smudging. It's a little different
mm.
aspect where you're
Very
not
good. Very good.
ingesting the herbs, but
Mm,
being able to use those traditional medicines of
yeah.
tobacco, sage, cedar, and sweetgrass to help with the healing process, um,
Mm-mm.
is an important part of ceremonies and healing for a lot of Indigenous
Mm.
people.
Wonderful. And I'm sure that when they go back to their communities, they have additional support, spiritual
Yes.
type of support anyway. But I was just curious about if there had been a merge. I smudge my house all the time. I love it.
Yes,
Yeah.
yes. I would love to see more of it. There's
Mm,
definitely an increase in what our Indigenous patients are reclaiming and advocating for themselves.
yeah. Especially a lot of the older, maybe what your grandparents or some of the elders in the community, how they could heal disease with roots and herbs and bark
Yes.
and fresh live plants. I mean, I've always been amazed at that, you know. So,
Yeah, me
wouldn't it be
too.
nice if we could merge that in the
Yes, it
future?
would be. It would be.
Yeah, that would be incredible. So, Misty, you have a motto you'd like to share with our viewers. What is your motto?
I have a couple. Number one is something that I was taught by a mentor of mine, Beverly Warren. She always said, "Be a good relative," and I love that.
Oh,
And I've
wow.
shared that as often as I can because
Mm,
it isn't just about being a good relative to our blood relatives. It's about being a good relative to everybody, every other human,
mm.
every other animal, every other plant, tree, the water, the rocks, like every
Ah, wow.
living being. It's to be a good relative. So
Yeah.
I try really hard to live by that motto. Um, I also live by everything happens for a reason. We can plan things out to the best of our ability, and sometimes things don't work out, and you can be bummed and upset about it, but then recognize later that that wasn't meant to be. Something bigger and
Yeah.
better is
Mm.
what was meant to be all along. So
Yeah.
um I think having a positive and optimistic attitude and recognizing that things happen for a reason um helps keep me grounded and just moving forward. But those are a couple of my favorite mottos.
I love that. I wrote it down. Be a really good relative. I think that's important.
Yes.
I'm one of these people that I go into or very close to a forest, so I go and I talk to the trees.
Yeah.
It's
Yes.
important,
Yes.
right? They
Yeah.
are beings as well, aren't they? You know.
Yes. Yeah. I
So
do have one other one, and that is you cannot be what you cannot see. And that is um Marion Wright Edelman who said that. You cannot be what you cannot see. And so that one means a lot to me because, when I was going through graduate school, I would attend National Alaska Native American Indian Nurses Association conferences and NANAINA for short. I met some of the most incredible Native nurses that were in a variety of positions. The um, director of nursing for IHS, deans of nursing programs, faculty, researchers. And it was those experiences that helped me think, wow, I could do that someday. To not even know what was possible, but seeing these incredible Indigenous women in leadership positions helped me to realize that someday I could be there too.
right. And I'm going to guess that that is probably the biggest inspiration you can give to the nurses that you teach, that you bring into your program, right?
I hope
Yeah.
so.
Hmm.
I when I was sitting in my undergraduate research classes and policy classes, I would think, well, number one, I thought research was boring. I do not think that anymore. I think it's quite fascinating and changes the world and how we do things. And when I was learning about policy, I always thought, like, how am I going to make a difference? How can
Yeah.
I, as Misty Wilkie, res girl, make a difference in the world? And so it wasn't until I started teaching at Bemidji State and recognized that we had too few American Indian nursing students, and knew about this HRSA nursing workforce diversity grant, that I started to see, okay, this is how I can make a difference. I can apply for this grant funding and bring in um, federal grant dollars to help provide tuition assistance for Native nursing students, and provide them holistic cultural, academic, social, and financial support, things that I know Native students really need in order to succeed. It wasn't until those things fell into place that I finally realized, like, how I as a single individual can make a difference in the world. And so that's the story I like to share with students, because I know that they're probably thinking the same thing, like, what can little old me do to make a
Yeah.
difference? But there's a lot we can do as individuals to help change our community, our
Mm,
state, our
mm,
tribal and
yes.
indigenous health systems. It
Mm.
all starts with somebody's idea and somebody's work.
So, what is last question here? Thank you for coming here today. You've inspired me. What is your dream for the Indigenous people, not only in America but around the world? What would be? How would you clearly articulate your dream for them?
Um, I don't know that I can clearly articulate it, but I'll try. I Indigenous people around the world have suffered so much from colonization, and I think that is what has put us in the positions that we are in today, with poor health outcomes. We're at the top of the charts for every disparity there is. So my dream is to not have us be at the top of the chart for every health
Uh,
disparity. I want us to have health equity. I want us to
mm,
be in positions where we're not forced to be resilient, um, that we can just be healthy and happy, um, and living our cultural values and our traditional
mm.
ceremonies um, without challenges.
Yeah,
So that
yeah.
that's my ultimate dream. And the way I'm working towards that is by supporting, guiding, mentoring, advising American Indian Alaska Native nurses, that want to become doctorally prepared, and they can lead their own healthcare institutions if they're in administration. They can provide direct care for their tribal and urban communities as nurse practitioners, nurse midwives. Um, so, I'm hopefully, I'd like to think I'm doing my part by just diversifying the nursing workforce to improve health outcomes for not only Indigenous communities, but for everybody.
Right. Well, I'm sending a prayer up for you, for your dream to become reality.
Yeah.
Thank you.
Thank you, Dr. Misty Wilkie. You're an amazing human being. Thank you for everything that you do, and the future is yours to continue to inspire and teach others how to be a Ronnie.
Chimigwech, thank you very
Yeah.
much.
Thank you. Okay.